That data is kind of skewed. The PricewaterhouseCoopers looked at the costs of unnecessary testing to defensive medicine. They came up with a number of between $200 and $250 billion a year. Now, if you gave physicians health IT that had the ability to, and patients all had unique patient identifiers, and you embedded on that decision support software so that physicians had data on guidelines in their disease states, and you add into their appropriate use testing on their computers for appropriate testing of different disease states. And then you change medical liability from the contentious system it is for both the injured and the plaintiff and the defense. Because one of the problems with medical liability today is when somebody is in fact injured and is awarded, that award takes years to get to them. And 30 to 40% of that award is gone before they get it, because 30% goes to the contingency fees of the lawyers and then, of course, costs. So you're really dealing with a small percentage of what you started out with, which is unfair to the person who is in fact injured. So if we changed our system, and it doesn't have to be caps, it can be an administrative law court, it can be anything that is reasonable, where we have a panel of experts that look as to determine whether something's in fact a deviation from standard of care. And I really wonder if I'm sued, whether many of you out there really could tell you whether what I've done is a deviation from a known standard of care or not. So I think I ought to be judged by my peers. And if in fact that I failed a patient, that patient should get speedy remedy. And that's what we should be doing. We should not be putting an extra cost in things for doctors that are paying. You know, a few years ago, I was happy to get insurance when my insurance company left the state of Illinois, and our 10-man cardiology group paid $1,083,000 for malpractice insurance. $1,083,000. That's a lot of money. And that's in a group that's had a paucity of lawsuits. Now, this system doesn't work. And it's disingenuous to believe for 1 second that you can do healthcare reform without medical liability reform. You need to do medical liability reform, insurance reform, and we need to improve the order reform. And I don't do tests in my office because it makes money for me. I do tests in part to cover my tush, to make sure that I don't get sued, because unless you've been to court and sued in medical liability, you have no idea what it's like. So the answer is no. It's medical liability. If you reduce that cost by 50%, you reduce that cost, that $250 billion by 50%. It's $125 billion a year times 10 years is $1.25 trillion. That pays for health reform. That pays for it. Then do some insurance reform on top of that, and you can put a Dunkin' Donuts on Mars.
Congressman Kirk, one of the solutions that you've been presenting is to allow interstate commerce of health insurance. Right. And I have one concern with that, and that's that here in Illinois we have 47 mandates on the producers here within the state. So are you going to put some protections in that they'll be allowed to lower those standards to meet what the other states aren't required, or are you going to have the other states come up? Because if it's not equal, if Blue Cross of Illinois can't compete with a company from out of state because they have to have 47 state mandates in their plan. I mean, we've been talking about ERISA, but what about Sahira? I mean, the majority of people work for small companies, and that affects everyone with less than 50 employees.
I think we ought to talk about that for a comprehensive healthcare bill, because we can put in some minimum mandates, but then to have large, flexible insurance pools, because remember, in insurance, there's no magic to this. Getting the pool to be large and flexible lowers costs. One of the reasons why California comes in so much less than New Jersey. The trouble now is that the current legislation that we're debating has none of that. And I think that Americans should be able to buy insurance from any state in the union.
I'd like to follow up on the question that was just raised. according to a Business Week article in August of 2009, 94% of markets, of the 314 major metropolitan markets in the United States are controlled by one or two insurance companies. So they represent 94% of the share. How is this even legal in the United States? I mean, we talk about a free market system that allows competition to lower costs. Under this system, it seems impossible. And the discussion is not, this discussion is really not happening nationwide. You raised it a couple of times in your presentation, but we're not hearing about this in Washington. How is it possible? Why is there a lack of competition, and how do we generate that competition?
And I think we all know that where you have a lack of competition, you have high prices and lower service. And I think that's reflected in a lot of insurance markets in the United States. This is one unified market where you can buy many things from whatever provider you feel, but not insurance. And I think that competition is one of the geniuses of our country and will dramatically lower costs. And so, sir, right here.
Your comment about this whole area that we're talking, sorry. Ed Smith, I'm from this area in Florida. And your ideas are fantastic as far as I'm concerned. However, can we take the control away from the state? I'm for states' rights, absolutely. But we have to take the control away from the states, put it into a bond of the federal government, and then we can get competition. Am I wrong?
No, I mean, you don't have to create a federal bureaucracy. You could create a set of minimum standards and then make sure that each state meets those standards.
Am I wrong? I presume, and I'm not very bright, but I presume that the cost of medical care doesn't change much from New York to Chicago to Des Moines, Iowa.
That's not true, because the wages are so,
What I've seen, there isn't much different, but there's a big difference in health insurance costs. That's where the factors come in, and that's caused because of states' control, isn't it?
Some, like for example, the example that I gave here was from the worst state and best state. And I think the state of New Jersey shows exactly what not to do. Also, with my colleagues on the other side of the aisle, I said, even if you think that the Treasury, our Treasury, should be paying for more health care in America so that we would be borrowing more and more money, in the end, you will still be for the reforms I outlined. Because if you're subsidizing patients at the New Jersey rate, you are draining the Treasury at twice the rate than if you do all the reforms I talk about and get the California rate. So even so, you'll...
One more comment, if I can. Our doctor in Florida made the statement to us, and we're old, my wife and I, that 55 years of marriage, we got to be at a certain age. Anyway,
sir, God help you tonight.
My doctor said something for all of your benefits. They said, you never leave my office unless you have all your records. And you said it here. We have to carry our records with us, and we don't get overly tested that way. We can go into a doctor's office here, we can give them the records, and we have no problems, and there's no testing.
That's where there's substantial bipartisan agreement to base healthcare on the fully electronic medical record.
That's right.
The one thing I want to do is make sure that that record is owned by you.
When you go back in September, how will you vote on the Independent Medicare Advisory Council, IMAC, that is proposed by Obama that would have broad authority to rewrite the Medicare program from top to bottom? Obama proposes with this agency of 5 unelected bureaucrats to let the government decide who gets medical care and who doesn't.
I am generally against all of those proposals because in the end, healthcare should be between you and your doctor. And I'm very